Hi everybody, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. I'm often asked by patients about using cannabis or cannabinoid-based medicines to treat chronic pain, especially cancer pain. The issue had been that there was not a roadmap to follow on how to do so safely and effectively. Unbeknownst to many physicians and patients, in 2023, new clinical practice guidelines for cannabis and chronic pain management were released. They were developed by a group of Canadian researchers, physicians, and patients. And the guidelines note that cannabinoid-based medicines, or CBMs, may help clinicians offer an effective, less addictive alternative to opiates in patients with chronic pain and also comorbid conditions. The guidelines were published online March 27, 2023 in the journal Cannabis and Cannabinoid Research. A consistent criticism of CBM medicines has been the lack of quality research supporting its therapeutic utility. So to develop the current recommendations, the task force was developed and reviewed 47 pain management studies enrolling more than 11,000 patients. Half the studies, which was 22, were randomized controlled trials, which are the gold standard, and 12 of the 19 included systematic reviews focused solely on the randomized controlled trials. Overall, 38 of the 47 included studies demonstrated that CBM provided at least moderate benefits for chronic pain, resulting in a, quote, strong, end quote, recommendation, mostly as an adjunct or a replacement treatment in individuals living with chronic pain. Overall, the guidelines place a high value on improving chronic pain, functionality, and addressing comorbid or co-occurring conditions like insomnia, anxiety, depression, mobility, and inflammation. They also provide practical dosing and formulation tips to support the use of CBM in the clinical setting. And this is actually really important, obviously. When it comes to chronic pain, CBM is not a panacea. However, prior research suggests that cannabinoids and opioids share several pharmacologic properties, including independent but possibly related mechanisms for antinociception, making them an intriguing combination. Antinociception refers to the process or property of blocking or reducing the perception of painful stimulus by inhibiting the detection or processing of pain signals by the sensory neurons, or the nerves that carry the pain back. The recommendations highlight the evidence demonstrating the majority of participants were able to reduce use of routine pain medications with concomitant CBM opioid administration while simultaneously offering secondary benefits like improved sleep, anxiety, and mood, as well as prevention of opioid tolerance and dose escalation. Importantly, the guidelines offer an evidence-based algorithm with a clear framework for tapering patients off opiates, and that's key, especially those who are on more than 50 milligrams each day, which places them with a twofold greater risk for fatal overdose. So we have an opportunity to use cannabinoids in place of opioids in our patients. I think that's a positive thing and a wise choice in terms of risk versus benefits. On the other hand, we need to note that freely prescribing cannabinoids for chronic pain in patients who aren't on opioids is not necessarily a good practice. We have to take seriously the potential adverse effects of cannabis, including marijuana use disorder, which is recognized, and it leads to an interference with learning, memory impairment, and psychotic breakthroughs. But for doctors interested in trying CBM for chronic pain patients, the guidelines offer a roadmap for the initiation and an alternative to prescribing opioids. And we know, again, the dangers of opiates. We hear every day about people ODing and dying from fentanyl and other opiates, which they think are just Percocet, for example, and contain fentanyl. So with that, I hope you learned something today. Thank you so much for listening. For more information or guidance, you can go to my website at www.paladinmds.com. And hope you have a great day. Thank you.